Kogi State government has launched a program tagged Bello Cares to take care of 15,000 Kogi children from 0 to 5 years, physically challenged and other vulnerable people across the 21 local government areas. Governor Bello gave the assurance during the launching in the government house, Lokoja. He said under the State Health Insurance Agency, no one is allowed to suffer setback when it comes to taking care of their health because a state with elderly people is wealthy. Bello already donated 180 million naira to the agency to kickstart over 100 of already registered health care facilities to take care of the beneficiaries. Our reporter has more.
Kogi State Governor Bello said the program would grant 15,000 indigent and vulnerable people in the state access to quality health care under the State Health Insurance Agency across the 21 local government areas. He said health is among his administration's top priorities and that no one is permitted to be sick or lack money to treat his or herself under his watch, hence releasing the sum of 180 million naira as a take-off fund for the program, as well as 70 million naira counterpart fund paid to the federal government.
Kogi State here, health is the second out of our 5 thematic areas. Of course, after education, next is health. And I appreciate all of those who delivered goodwill messages, the representative of the various bodies, the WHO and the rest, who made the analysis, simply put, that health is wealth. Health is education. Health is enlightenment. And if we human beings are created to come and dominate the world, how do we achieve that? Without health, without wealth, without education. And if you look at all of these, it has been captured well by the new direction administration currently. And that is why we are here today and we see the various programs and projects being executed by this administration under my leadership. All the points, demands, and various fears that have been expressed, I want to assure you that without you even mentioning them, we will take care of it. Bello Care will not just be limited to just health insurance alone. It will transcend beyond health insurance. I encourage every well-spirited citizens of Kogi State to please buy and enroll a lot more into this particular scheme.
The governor said that the health insurance agency will cater for pregnant women, children between the ages of 0 to 5 years, persons with disabilities, and the poor and the vulnerable as part of the 15,000 beneficiaries of the program to begin with. The Executive Secretary of the State Health Insurance Agency, Dr. Kunle Aledare, thanked the governor for giving priority to the health care of people, assured the government and the people of Kogi of all stakeholders to play their role without jeopardizing the purpose the agency is meant for.
And the Bello Care initiative is designed to complement the Basic Healthcare Provision Fund of the federal government. Under the Basic Healthcare Provision Fund of the federal government, Kogi State Insurance Agency have enrolled 30,898 enrollees across the 21 local governments, and the same category of vulnerable people that are benefiting. One primary center per ward have been selected, and there are about 131 beneficiaries in each ward, in each primary center across the 239 wards, and very soon access to care will commence. Kogi State Insurance Agency have also paid capitation, which is the monthly payment to 220 healthcare facilities out of the 239, and in order to spur them to action so that the beneficiaries can access the Basic Healthcare Provision Fund. I would like to say that Kogi State is among the few states that have prioritized the release of this equity fund to complement the Basic Healthcare Provision Fund in order to expand the population coverage in the state. We have enrolled 13,440 persons under the Bello Care across the 21 local governments, and enrollment is still ongoing because the target is 15,000. Bello Care affords the beneficiary primary level of care to tertiary level of care, ranging from general consultation for common diseases, surgeries, and other specialties that involve free of charge.
The State Commissioner for Health, Dr. Usman Zakari, said plans were underway to capture state civil servants and students of tertiary institutions in the state, while the Executive Director, Kogi State Primary Health Care Development Agency, Dr. Abubakar Yakubu, made the case for harmonization of all primary health care across the state.
Healthcare services in the midst of persistent high out-of-pocket expenditure on health is worrisome, and the social inequalities in health adversely affect the poor more than the rich. The most vulnerable groups oftentimes do not receive the healthcare services they need due to lack of money to seek healthcare, ignorance, and poverty, leading to increased mobility, poor life expectancy, and most times premature death. The idea of launching Bello Care initiative to provide hope for the vulnerable persons who cannot afford quality healthcare services is to stem the tide in mortality and morbidity amongst the target groups, improve their quality of life so that they can become more productive and live healthier lives. Your Excellency, posterity will be kind to you, and history will record your administration as one that spared no expenses, developing a resilient healthcare system capable of securing the future of Kogi State in a manner never witnessed before.
What is left for us to achieve is to bring the health workers, the local government health workers, under the State Primary Health Care Development Agency, where the state will have a supervisory role on them, pay their salaries, appoint and fire any area staffs. This is very important point that will give us the required percentage that will be necessary for the National Primary Health Care to consider us as having fully implemented this primary health care under one roof.
In a goodwill message, Kogi State Chairman of the NLC, Onu Edoka, represented by the State Chairman, Medical and Health Workers Union of Nigeria, Amari Gabriel, called for full implementation of the primary health care under one roof to maximize the benefits of various health interventions, particularly at the grassroots.
I'm also directed to only appeal to the government, in as much as the workers are ready to contribute from their salary, so that our people in the rural area will benefit. It is not just we that are in the city, but our people down there in the villages. We only want to appeal to the government to be faithful in also remitting their counterpart form to sustain this program. We don't want a situation where this program will commence and people are happy, and along the line, prescription is given to you, they say there's no drug, go and buy from the pharmacy. It will not happen. Primary health care as the bedrock of attaining universal health coverage. Sir, I want to commend you again for ascending to that bill into law, bringing primary health care under one roof in the state. And I believe, I know your capacity, you are the type that doesn't believe in failure.
World Health Organizations and other health agencies represented commended Governor Bello for domesticated health insurance agencies in the state.
Your Excellency, I want to encourage you to do more in health. Bello Care is a laudable venture. And when you provide health, your people can be healthy to make wealth. Your people can be healthy to go to school. Then we break that chain of poverty and ignorance. That's why I'm excited today.
And Kogi State is one of those few states, plus my state anyway, Nasara, that the state governor is giving money from the state account to fund the vulnerable. It's very rare. Most of the states are depending on what the federal government is bringing. And as awareness is continuous going, people are asking, what is the state doing? And Kogi State, the answer has been given to you because the governor has already done that. Now, what is happening today has health impact, because with this, your health outlook is going to improve, because there are people that don't access care because they don't have money. And that has increased burden of diseases, and that has increased mortality. So you're going to improve your health indices in the state. There's economic component of it. Since the inception of this agency, I'm sure there are people that didn't have a job, whether they are even casual, at least they have something to do. And for people also that will benefit from this, what it means is that they are healthy enough, or their money that they used to pay for health care, they can use it for something else. That is economic benefit.
What you are doing, it's another way of poverty reduction. That's what you are doing. In fact, you are one of the greatest poverty reduction strategies is when you prevent people from the impoverishments that come out of the need for health services.
The governor used the occasion to present symbolic identity cards to beneficiaries. The program was spiced with a dance drama. Khadijat Mohammed, reporting for MLC TV.